So if you can't breathe properly through your nose, when you're sleeping at night, then any treatment that we try coming after the sleep apnea, we might get lucky and it might be successful. We didn't get lucky last time you tried with it, and I'd say it's not surprising given now that we know the overall situation. I'd say we didn't even know you had sleep apnea. This is problematic by itself. From a sleep apnea front, your throat is tight. So when I look in the back of your throat, you're tight all the way around the circle back there, meaning your tongue is big in relation to the size of the back of your throat. That actually seems to be the biggest issue you got, where that tongue is getting in your way, and when you're trying to breathe, it's not letting you. So when you're upright like you are right now, this is as open as your airway is going to be. When we lay you down, everything wants to collapse on itself, and so that tongue seems to be a big issue. So basically, there's a circle in the back of your throat, which is your airway. From the bottom up, your tongue is filling in space, and then you're crowded also from the sides in and from the top down. The top down is where the little uvula comes in, so that part's elongated and kind of drawn in from the sides, and then the tongue is getting in your way. So when you're sleeping, the snoring is coming from typically the palate, so that area where the uvula is, that's vibrating, that's creating the sound, but the tightness is coming all the way around that circle. Worst case scenario is the current case scenario is you can't breathe through your nose properly, your mouth comes open, your tongue falls backwards, takes tight and shuts it down, and there's not really an out for you right now. Your body is never getting into those deep stages of sleep ever, because almost by definition is by the time your body relaxes enough to get into sleep, your tongue is now in your way, you can't breathe, your body has to wake up, and so it's sort of this constant sort of skimming the surface but never getting deep for years, and obviously that's not helping anything, but it's probably hurting more things than you can possibly be aware of, because the impact of that, that untreated sleep apnea, it's just, there's nothing good about it. It's bad for you, meaning it drags you down, and you're conscious of that, but then it's both scary and annoying for those around you, so there's nothing good about that. And then unfortunately the other reality is, given your degree of sleep apnea and the fact that we're just not able to treat it properly right now, it's really hard on your body. And so meaning it's really hard on your heart, it's really hard on your lungs, it's really just hard on your whole system. Couple ways. One is, you're never getting restful sleep, and restful sleep is one of the few keys to kind of a healthy life, both mentally and physically. If you can sleep properly, that optimizes you as much as you can. Mentally and physically, if you cannot sleep properly, it drains you, and just the exact time when your body's trying to rest and recover is instead the time that your body's fighting for its life, literally. And so it's kind of this perfect storm of like your body going into battle mode when it should be going into rest and recovery mode, and that carries on through the day. Your body's wired in one of two ways: either fight or flight, or kind of either things are really bad and you need to kind of get your defenses up and kind of be ready and get that adrenaline surge, or you can chill and everything's good and that's all fine. This first thing I was talking about is constantly going, and so most folks who have sleep apnea that isn't treated properly over time, their blood pressure tends to come up because their body is constantly sort of in intense tension mode, and then it can lead to other things too. So I'm not going to dwell on that too much, but I would say the situation at hand, sleep apnea wise, is kind of creating the known issues that you know about, and then it's creating sort of a ticking time bomb behind the scenes, and then on both fronts, issues that you just, I don't think can know about or will know about until we can get you where you need to be. So long story short, I'd say, yep, sleep apnea, you got it. Your anatomy matches up with that. I'd say on the weight front, it's both things coming together. So I'd say extra weight narrows your airway down, which makes the sleep apnea worse. Poor sleep and sleep apnea are guaranteed for gaining weight, and it's just that vicious cycle. Our goal right now is break that cycle, get your airway, on your side versus against you, and then, come after things in a thoughtful manner. From the sleep and the sleep apnea standpoint, you're tight in the back of your throat. Conceptually, there are three different options that you've got. One that you kind of tried, you tried a version of it with the nose that was not helping you, but basically the Cpap machine or BiPAP machines are machines that you can wear on your nose or your mouth. They're just basically pushing air back there to hold the back of your throat open. They're not oxygen machines, they're just tenting the space open. So in an ideal world, with that Cpap option, the best way to use a Cpap machine is through a nose that's open and a mouth that's shut. And so the least common way to use a Cpap machine is through a nose that's open and a mouth that's shut, because just like you, most folks who have sleep apnea also, lo and behold, have noses that aren't working, but the typical medical model is blind to that. It just doesn't, for whatever reason, doesn't want to look at that. And so most of the time it's just like you, where you go in, get a sleep study, you had and have, significant nose and sinus issues that everybody just sort of says, well, whatever, we're not gonna, I don't know if they asked you, certainly didn't look. The typical model is we don't care whether your nose works or doesn't work. We're going to assume that it doesn't work, because most of the time it doesn't, and you're the typical situation that way. And so if it doesn't work, well, we can't trust it, so let's put a full face mask on you and try to force you to breathe through that. And that's the most cumbersome way to use a CPAP machine or a BiPAP machine. That's the most common way that it's prescribed, because, again, other than in situations like ours where we can address the nose, it's sort of like, well, okay, if you can't address it, just work around it. And a lot of people you get in this blind alley of knowing you have an issue, knowing you want to treat it, knowing you can't treat it with the tools that are given to you. So I'd say in the CPAP, BiPAP front, I know you had a bad experience there, but I'd say, again, we'll talk about the nose in a second, but if we can get your nose where it needs to be, then that machine, it can be a good option. And the best way, and the ideal way, would be get your nose working. And if we wanted to go down that road, it would be using a nasal mask or a nasal pillow mask. So just use your nose, keep your mouth out of it, and see what that feels like. If your nose is open and the machine is pushing air through an open nose, it's as mellow and low key and as effective as it can be. Mm-hmm. And so even though, a lot of times that bridge gets burned, unfortunately, with experiences like yours, but if it's burned, it's burned, but hopefully it's not completely burned. So I'd say, again, that's still a reasonable concept and something to consider. And oftentimes, much more often than not, is in this sort of situation, if you get your nose working and try a machine through that open nose, most folks find it actually, tolerable, helpful, all that good stuff. So that's the machine option. Another option, that very well might be a good one for you is an oral appliance, which is basically a retainer that you can wear when you're sleeping at night. It sits in your mouth between your upper and lower teeth, and what that's doing, it does a couple things. One is it helps to keep your mouth shut. Two is it basically tucks your lower jaw forward a little bit. Your tongue's attached to your lower jaw, so when you pull that lower jaw forward just a little bit, just a millimeter or two sometimes, that gets your tongue out of the back of your throat, and all of a sudden, you're able to breathe. That too, just like the CPAP machine option, to tolerate an oral appliance, you've got to be able to breathe through your nose, because if you can't, then you've got something sitting in your mouth that you're fighting on in a different way with a different object. Mm-hmm. So in your case too, I'd say, yep, oral appliance could work. Could really only work if we can get that nose, on track, kind of a thing. And then the final option, like with the final treatment option, coming out of the sleep apnea, would be procedures in the back of the throat to open things up back there. That, generally speaking, is the least likely option that we'd recommend. And specific to you, I'd say, yep, I'd put that number 3 on my list. The biggest issue you've got is your tongue. We can't do much procedure-wise for the back of the tongue to help. Where we can do more is on the palate and the sides of the throat. And so there's some work we could do there to open that up. But if we can't kind of hit the key target procedurally, then in my opinion, you sort of kind of put it to the back burner, because both the CPAP machine and the oral appliances, they mainly work on that tongue area, and that's the issue. That's the main issue you've got. So nose-wise, and this is a ton of information, so I understand it's a lot coming at you, but nose-wise, back to kind of where we're sitting with that is we've got anatomy issues and lining issues, and treating the lining in your case isn't both been proven based on what you've noticed isn't going to do enough, and from the likelihood from what we're seeing isn't going to do enough. And so it's really, how can we address the anatomy to get things open there, both for its own sake as well as to prepare you to move in the next to the next step from a sleep apnea standpoint. And in your case, there's really 2 different roads you can go down. There's an office-based road, so things we can do here in the office with you awake, and then there's a surgical road, which is something you go to sleep to have done. There's really pros and cons to both. There's not like one's bad, one's good, or vice versa. They're just sort of different, and we can we're putting you through different things. We're expecting sort of different landing spot. So office-based procedures are things we do here in the office. They're done with you awake. So our first step is just get your nose numbed up. So we're spraying numbing medicine in your nose. Once that takes hold, we do numbing injections, so that gets things frozen in there. And then we're doing a couple things. One is looking at your nose with a camera up towards where those sinus areas are tight. And what we end up doing up there is using a balloon to get in those tight spaces, and then we inflate that to expand those openings. So those are bony openings that in your case are either nearly shut or close to that. And so what we're trying to do is take those tight spaces and open them up. Sinus-wise, when we do that, when we open those spaces up, the area of the sinuses that's inflamed is able to drain through those openings, and oftentimes, usually that lining is able to kind of calm itself down over time. So even though we're not doing any of the lining itself, we are just getting the plumbing working. Getting that plumbing working is sort of the first step towards kind of getting back on the healthy road there. But anyway.
Are those bony structures actually like breaking and then mending?
Yeah, so they're yeah, exactly. So it's bone. It's fairly pliable bone in the grand scheme of things. So it's not like rock hard or nearly rock hard like this sort of bone. It's kind of more like cardboard-ish, but stiff. And so works both ways, meaning when we get those areas open, it's open. Because it's bone, it stays where we put it, and so that's why that balloon can create a change that's lasting, kind of a thing. But again, back to that procedure, it's getting in there, getting those sinus areas open to allow those guys to behave properly. And then the second part of that is where the turbinates are big, we want to make them smaller. And so how we do that is we put a probe into them that's connected to a machine. That creates radio frequency energy, which basically just means it allows us to shrink the turbinates down. So you take something that's big and you make it smaller. Turbinates, there's a few layers on them. It's bone underneath the surface. There's soft tissue overlying that, and then there's kind of the skin of the nose on top of that. And so when you lay down, right now what happens is the soft tissue swells up, and that's what plugs you up. So what we end up doing when we're reducing those structures is we get into that soft tissue and we cause it to contract down and make it smaller. So we're kind of scarring it underneath the surface, so it's both smaller day to day and decrease its ability to get big when you lay down or if allergies are kicking in. So we're just trying to get those guys out of your way. So with the office procedure, get the sinuses open with the balloon, get the turbinates reduced with copulation is what it's called, but basically get them smaller. Back into something like that is something you head out on your own. You can blow your nose, kind of do what you normally do. The negative afterwards is that it makes you feel like we just gave you a cold, so you're extra stuffy. First week's the worst of times. Once you get through that, then you're starting to move. And then kind of week by week over the next month or so is where most of the changes are happening. So like once you get out of the sort of the first phase of things, things are opening up, things are settling down, and then you and we are figuring out is that made as much of a change as we need. So by about 6 weeks after procedure, we should have a pretty good sense as to did we do what we wanted to do or needed to do or not. But so that's office. Surgery is the other way you can go. Surgery is something you're asleep versus being awake. Everything still happens on the inside of your nose, so nothing on the outside. With surgery, from a sinus front, same deal, just different techniques. So we look in the nose with a camera. We look up to where the sinuses come in. Sometimes we'll use the balloon in surgery itself. Oftentimes we'll use different techniques, meaning that instead of using a balloon in surgery to dilate the opening, we actually are removing some of that blocking tissue to open it a different way. We can be a little bit more aggressive in surgery as far as how we want to open those sinuses up. Turbinates are pretty much the same. Same thing. Well, sometimes we'll use some different techniques in surgery versus what we do here, but conceptually we're just trying to make them smaller. So get the turbinates reduced. The additional step that we can take in surgery that we can't take here is where that septum is bent, we can straighten it out. So to do that, what we do is on the inside of your nose, we make an incision into the skin, get access to that cartilage, and then we're taking out little struts of that guy to get it back in the middle, and then close it back up. So surgery, that you go home the same day. It's more intense than the office is sort of the bottom line. So first couple of days it's messy, so it's just kind of bloody drainage. Then it's stuffy. Stuffy with surgery is a lot more stuffy than the office. Stuffy with surgery feels like you got a bad sinus infection, really stuffed up, really annoyed. First week's still the worst. It still needs to fade. It just takes kind of longer to get where it's going. So surgery, we're putting you through more. We're doing more. We're kind of being more aggressive in the things that we're doing. Therefore, the recovery is more intense. Surgery gets you as open as you can possibly be, both from a sinus standpoint and a nose standpoint, because we're addressing the septum, or kind of addressing those sinuses differently. So surgery is as open as you can be, but the recovery is more intense because the actual procedures are more intense. Office procedures are as open as you can be, short of surgery. The biggest difference between the two, The septum is, I'd say, the biggest difference. You know, you've got a deviated septum. The question with the office would be, can we leave your septum alone? Can we get enough space around the septum so that, you know, really what we need at the end of the day from your nose and the sinuses is, can you breathe comfortably, you know, through your mouth or through your nose with your mouth shut day and night? And it looks doable with the office procedure. So I guess if that's the goal, I'd say that looks to be an achievable goal with the office. So if we went down the office road, it'd be do it, get you landed, and then we wouldn't have to guess at that point. You would be able to say, and we would be able to look and say, yep, that's good, we're good to go, that's great. Or alternatively, and less likely but possible, is if we do it, get you landed, and it's just not as much of a difference as you're hoping for, we still have the option of going up the ladder to surgery and take care of the septum. Nose and sinus wise, any thoughts between those two different pathways?
If you feel like there's a good chance that my septum will not preclude us for the office-based stuff from working, I would love to start there and,
Okay, that's fine.
Make surgery our
That's fine.
last effort.
That's fine. Yeah, and I do. Our next step down that road would be really just getting things authorized insurance-wise, you know, basically getting their blessing and getting it done, getting things moving, and then, you know, going from there. Sleep-wise, you can make an argument to say, hey, let's you know, once the nose is working, let's try that machine, give it a fair shake through a nose that's open, see where that takes us, go from there. You can make an argument to say, yeah, well, we've tried the machine, didn't go so well. Yep, let's get the nose working. Let's go towards an oral appliance and then go from there. The difference is, the proof is going to be in the reality. Get your nose working, and whether it's an oral appliance or a Cpap machine, they need to be working. And working means you're sleeping quietly, resting comfortably, you know, so forth and so on. Mm-hmm. The difference between the two things is an oral appliance doesn't record data. It's not telling us whether it's working or not definitively on a night-by-night basis. The Cpap machines or BiPAP machines do. So if we went down that road, it'd be get your nose working, get you in a machine, and then every night that machine is recording data on, you know, how long did you sleep, any pauses, all that sort of stuff. And so there's not like a right or wrong between the two. There's a little bit of a extra nuanced Cpap machine that, you know, that has that the appliance doesn't. But I'd say on the back end of the nose, I'd really kind of put it in your court as far as, you know, which direction we go, knowing that if whatever direction we choose isn't going so well, we can always kind of pivot to the other. So any thoughts on that part of the equation?
I'm certainly willing to try Cpap again.
Okay.
But I also do like the idea of an oral appliance.
Either is fine. Either is reasonable. Neither can work right now with the nose the way it is, and so we're not even going to mess around with them until we get the nose on our side. And then the final component of all this, I'd say, back to the weight, get your nose working, get the sleep apnea treated. You know, so basically get your airway working day and night, and see what that feels like. Then I'd say ultimate would be, now that you're having that restful sleep, let us sort of start a game plan to dial that weight the other direction. Mm-hmm. Because if you are getting restful sleep, there's a fighting chance of getting weight off. Basically, if you're not getting restful sleep, it's almost impossible to make any dents in that.
Well, I feel like we got 3 or 4 episodes of Erik's journey.
Well, you had your visit with Dr. Kandula. My name is Megan. I am his treatment coordinator here at Advent Wauwatosa Clinic. So after meeting with him, he did provide his recommendations, and he is recommending an in-office procedure. So we're going to go ahead and get you scheduled today. And do you have any questions before we get that started?
No, I don't think so.
Okay, perfect.
Yep, looks good.
All right, perfect.
There's an L10 meeting, but you know,
Okay.
I'll take any excuse to get out of one of those.
So right now we don't have a confirmed time. We'll be calling you 1 week prior to provide that to you. So just prepare for that to be in the morning though.
Okay.
Did Dr. Kandula talk about pre-med with you in the room today?
Yes.
Okay.
Yeah.
And is that something that you're going to be interested in
I
having
don't think
prescribed?
so.
No. Okay.
Nope.
That works. And then we're going to schedule your 1 week follow-up to the procedure. Just make sure everything's going well for that healing process.
Okay. Give us another L10.
2 weeks in a row, they're gonna love you. Okay, so now that we have everything scheduled, I'm gonna go ahead and create your consent form, print that out, and we'll go through everything.
Okay.
Keep in mind that everything that you're signing today, you're also gonna be going home with a copy of in a folder.
Okay, great.
great.
Okay, and then you'll hear back from either myself or someone within our department 1 week prior to your procedure.
Perfect.
All right. That's all yours.
Awesome.
Thank
All right.
you.
Thank you so much.
You're welcome.
Appreciate all the help.
Have a good rest of your day.
You too.
Thanks.